Eggs are one of the most common allergy-causing foods for children. Egg allergy symptoms usually occur a few minutes to a few hours after eating eggs or food containing eggs. Signs and symptoms range from mild to severe and can include skin rashes, hives, nasal congestion, and vomiting, or other digestive problems. Soybeans are in the legume family, which also includes foods such as kidney beans, peas, lentils, and peanuts. Whole, immature soybeans are also known as edamame. Soy is one of the most difficult products for people with allergies to avoid. In this video, we are going to discuss soy and egg allergies and other causes of atopic dermatitis plus symptoms and treatment. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. A soy allergy occurs when the body's immune system mistakes the harmless proteins found in soy for atopic dermatitis and creates antibodies against them. The next time a soy product is consumed, the immune system releases substances such as histamines to protect the body. The release of these substances causes an allergic reaction. Soy is one of the big 8 allergens, along with cow's milk, eggs, peanuts, tree nuts, wheat, fish, and shellfish. These are responsible for 90% of all food allergies. According to the Cleveland Clinic, soy allergy is one of several food allergies that begin early in life, usually before age 3, and often resolves by age 10. Rarely, egg allergy can cause anaphylaxis, a life-threatening reaction. Egg allergy can occur as early as infancy. Most children, but not all, outgrow their egg allergy before atopic dermatitis adolescence. Patients who are allergic to foods include soy and egg, are allergic to proteins in the foods, and are not allergic to the oils or fats in the foods. Soybean oil and egg lecithin may contain trace amounts of residual protein. However, no allergic reactions have been demonstrated to be caused by this. Although peanuts and soybeans are both in the legume family, the overwhelmingly majority of peanut allergic patients are not clinically allergic to soy, and even if they were, would not be expected to react to soybean oil. There are reports of reactions to propofol, including hives and other symptoms of systemic allergic reactions, anaphylaxis. However, most reports of anaphylaxis to propofol have occurred in patients without egg allergy, and the vast majority of patients with egg allergy receive propofol without reaction. Some patients may be allergic to propofol itself. Also, most patients who react after receiving propofol have received other drugs at the same time that can cause or worsen anaphylaxis, including antibiotics, muscle relaxants, and narcotic pain medications. Thus, although it is clear that propofol can cause anaphylactic reactions, the cause of these reactions is unclear and appears not to be related to soy or egg allergy. Symptoms of a soy allergy may range from mild to severe and include abdominal pain, diarrhea, nausea, vomiting, runny nose, wheezing, trouble breathing, itchy mouth, and skin reactions including hives and rashes. Egg allergy reactions vary from person to person and usually occur soon after exposure to an egg. Egg allergy symptoms can include skin inflammation or hives, nasal congestion, runny nose and sneezing, allergic rhinitis, and digestive symptoms such as cramps, nausea, and vomiting. Atopic dermatitis, eczema, is a condition that makes your skin red and itchy. It's common in children but can occur at any age. Atopic dermatitis is long-lasting, chronic, and tends to flare periodically. It may be accompanied by asthma or hay fever. No cure has been found for atopic dermatitis, but treatments and self-care measures can relieve itching and prevent new outbreaks. For example, it helps to avoid harsh soaps, moisturize your skin regularly, and apply medicated creams or ointments. There is no known single cause for atopic dermatitis eczema, and it probably represents more than one condition. There are many theories regarding the underlying mechanisms. Current research is investigating the roles of the immune system, skin, structural gene mutations, defects in the skin cells, keratinocytes, the skin surface microbiome, bacteria, viruses, and yeast, and many other factors. Current theories identify that atopic dermatitis is primarily a disease of the immune system, with cytokines being critical components to the disease. Eczema affects up to 15 million Americans. Infants are prone to eczema, and 10% to 20% will have it. However, nearly half outgrow the condition or have significant improvement as they get older. Eczema affects males and females equally and is more common in people who have a personal or family history of asthma. Environmental allergies and/or food allergies. In the United States, about 7.2% of atopic dermatitis and 11.6% of children are thought to have eczema or skin allergies, according to the Centers for Disease Control and Prevention (CDC). It affects people of all ethnicities, but the Center for Disease Control and Prevention data suggests that African American children have the highest rates. An estimated 17.8 million people have atopic dermatitis, most of whom are undiagnosed. About 10 to 30% of children and 2 to 10% of atopic dermatitis in developed countries have atopic dermatitis. Per 2021 research, atopic dermatitis in childhood about 80% of the time. There seems to be a genetic component to atopic dermatitis. People with atopic dermatitis typically have a family member affected by the condition, and changes to the filaggrin gene have been linked as a risk factor for atopic dermatitis. People with atopic dermatitis are also more likely to have other atopic conditions, such as allergies or asthma. Atopic dermatitis can be persistent. You may need to try various treatments over months or years to control it, and even if treatment is successful, signs and symptoms may return, flare. It's important to recognize the condition early so that you can start treatment. The Food and Drug Administration have recently approved a new injectable biological monoclonal antibody called dupilumab, Dupixent. It is used to treat people with severe diseases who do not respond well to other treatment options. This is a newer medication, so it doesn't have a long track record in terms of how well it helps people. Studies have shown it to be safe if used as directed. It is very expensive. Your doctor may prescribe a corticosteroid cream or ointment. Apply it as directed after you moisturize. Overuse of this drug may cause side effects, including thinning skin. Other creams containing drugs called calcineurin inhibitors, such as tacrolimus, Protopic, and pimecromylus, Elidel, affect your immune system. They are used by people older than age 2 to help control the skin reaction. Apply it as directed after you moisturize. Avoid strong sunlight when using these products. These drugs have a black box warning about the potential risk of cancer, but the American Academy of Allergy, Asthma, and Immunology have concluded that the risk-to-benefit ratios of topical pimecrolimus and tacrolimus are similar to those of most of conventional treatments or persistent eczema, and that the data don't support the use of black box warning. In rare cases, your doctor may prescribe oral corticosteroids for 5 to 7 days. These tablets come with a higher risk of side effects and are generally avoided. An injected biological medication called dupilumab have been approved by the Food and Drug Administration to treat atopic dermatitis that you can't manage with other prescription therapies. It works by reducing the release of signaling molecules called interleukins that promote inflammation. Your doctor may also prescribe medicated bandages or wet wraps to apply over affected areas to keep your skin moist and prevent itchiness. You should see a primary care physician or a dermatologist to receive your initial diagnosis. A doctor can help you create an effective treatment plan and understand your triggers. If atopic dermatitis is affecting your life, it's also a good idea to speak with a doctor to develop a management plan. It's not entirely clear why some people develop atopic dermatitis, but there's currently no known way to prevent it from developing. But keeping your skin moist and forming an understanding of what causes your atopic dermatitis to flare up can help you minimize your symptoms. Eczema is a common inflammatory skin condition. Eczema can show up anywhere on your skin. In teens and adults, it's typically found on your hands, neck, inner elbows, ankles, knees, feet, and around your eyes. Eczema is most common in children, but the majority of children will grow out of it by the time they reach adolescence. Eczema can cause discomfort and can vary in severity. It can present differently depending on a person's age. In people with darker skin tones, the symptoms may be harder to see. Although there is currently no cure, people can treat and prevent eczema flares using home remedies, moisturizers, medications, and lifestyle changes. By learning your triggers and taking good care of your skin, you can reduce the frequency and severity of your atopic dermatitis flare-ups. Even if your first treatment plan doesn't work, there are many different things you can try. You and a doctor can work together to find a combination that works for you and your skin. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.